Hello, everyone. I'm Suleima Salgado, the CEO for the Global Partnership for Telehealth and the Principal Investigator for the Southeastern Telehealth Resource Center. I'm delighted to be here with you today to discuss a little bit more about telemedicine and digital tools that are revolutionizing access to care and are specifically breaking barriers, expanding possibilities, and reimbursement. Again, for us, GPT, the belief at our organization is really simple, that telehealth should never replace local healthcare, but simply enhance and broaden the scope of access. In doing so, telehealth technologies for us, we believe that they should not be disruptive, but quietly and effectively support the process and workflows that already exist within various healthcare organizations. Really, for us, we really want to encourage the adoption and usage of telehealth technology rather than frustrate or discourage users from the experience, but also providers from leveraging the digital tools. So again, as we always state, telemedicine is not a replacement of a medical home, but it is added value to existing clinical models. Today, I really want to focus on a couple things. Really my goal is to help you understand the fundamentals of telehealth. Really, what is telehealth, telemedicine? How are those terms used? Are they interchangeable? Evaluate some of the benefits and challenges of telehealth. So share with you a little bit of success stories around telehealth, share with you some common challenges and limitations that people face and barriers when implementing telehealth, and then just show some strategies for best practices of implementing telehealth consultations. So giving you a couple examples, showing you some resources, equipment, and platform. So what is telehealth? And as you can see, it is defined as a care delivery method that enables providers to deliver clinical and non-clinical services to patients without an in-person visit. I always like to joke around and say, if you leverage FaceTime, WhatsApp, any video platform that you use to talk to friends, family, and loved ones, that is truly a form of telehealth without the clinical obvious experience. So video conferencing, two-way video to interact and engage on a secured network and exchanging patient information is truly telehealth. As you all know, if the COVID pandemic had taught us anything, it gave telehealth a much needed boost. I always joke around that for me, after 20 plus years of trying to encourage telehealth expansion, the COVID pandemic really brightened that awareness and allowed people to see the benefits of leveraging digital technology to increase access to care and really most for convenience. What are the various commonly used approaches for telehealth? Well, you probably hear about some of these and you've heard them before, but there are virtual visits, which I like to refer to those as live, synchronous, real-time, interactive encounters between a patient and your healthcare provider via phone, video, or live chat. You have these chat-based interactions, which are asynchronous, and they're online or on a mobile app where they transmit patients' personal health data, vital signs, and other diagnosis through review and data of a consultation. So I like to call those more of like the store and forward type models, where you're uploading things to a portal, you're sending notes and minutes and talking, but again, it is just web-based. Remote patient monitoring is another form of tool where we collect, transmit, evaluate, and communicate different individual health data from patients to their healthcare provider or extended care team from outside hospital or clinical offices. So a lot of remote patient monitoring where we use sometimes you wear a mobile device, a smartphone, health monitors, and different mobile apps. There's also technology-enabled modalities that are really beneficial, and that's more of Project Echo type, so provider to provider. Telehealth goals and benefits are really important, and I think it's most important for you to realize that the goal for telehealth is to address provider shortage. We really want to improve patient access. We want to work on overcoming those geographical barriers, and we really want to look at the needs in those communities and leverage telehealth to add value to existing practices and not intended to replace a medical home. There are many types of telehealth services, and I always like to put this as a snapshot to show people the different types of telehealth services because everyone's always like, well, do you just use it for remote care or acute care, or is it urgent care? Telehealth can look however you want it based on your existing practice and what your needs are. So I like to say it's available for audiology, behavioral health, cardiology, community paramedicine, dental, dermatology. We see a lot of infectious disease care. We also work with our women, infants, and children programs to provide maternal fetal medicine services, lactation education, breastfeeding support. So really just nutrition education and support. But we also use a lot of telemedicine in our pediatric audience with our patients for pulmonology and endocrinology, a lot of psychiatry as well. So telemedicine is not a one size fits all, but you can accommodate it and make it and modify it based on your clinical needs and based on provider availability within your community. So where does telehealth and telemedicine even happen? An originating site is kind of what we like to refer to as, which is a presenting site and where those consultations can take place. Many people do it from their mobile phone and they can do it from the comfort of their home. But the most common originating and presenting sites are as you see on the screen. Could be in your local community health center, it could be in your school wellness clinic, it could be at your employer's wellness clinic, federally qualified health centers, mobile clinics. Some pharmacies have telemedicine cubes. Your primary care physician's office might have a telemedicine consult option where you can connect back to that provider, but you can connect to other subspecialties, skilled nursing facilities. One of our most popular is school nursing clinics, so schools leveraging telemedicine to connect back, and many urgent care facilities. We have a lot of experience across diverse clinical applications. And kind of like I mentioned just a minute ago, we at the Global Partnership for Telehealth and through the Southeastern Telehealth Resource Center really work a lot with a lot of public and private mental health organizations, including your community service boards. We work with our CMOs, our care management organizations, specifically in Georgia, CareSource, AmeriGroup, Peach State, and many of the others. We are involved in a lot of school-based telehealth centers within our colleges, universities, and academic schools. We work with our state government organizations, such as the Georgia Department of Public Health. As I mentioned earlier, many of our WIC programs at the state and local and district level, and many skilled nursing facilities. Not to forget our rural health systems, our rural hospitals, and our FQHCs, where they provide a lot of subspecialty care leveraging telemedicine. We also have partners in academia, such as the Mercer School of Medicine, the Georgia Rural Health Innovation Center, where we really look at rural communities, address their access needs, and really figure out how we can leverage telemedicine to increase value within their clinics. One may ask, what kind of technology do we need for telehealth and telemedicine? And it's pretty simple. Now, software-wise, you obviously need to have a HIPAA-compliant video conferencing platform, which is really important. I know the COVID pandemic gave us lots of flexibilities to not require the full HIPAA-compliant network, but moving forward, that will be critical and essential. From a hardware perspective, many of us have these devices already. So you have a computer or a mobile device, an integrated or external web camera, and then a microphone. So we want to make sure we can hear you, you can see us, and that you have an electronic device that can connect it on this web-based platform. As you all know, bandwidth is also super important. So ideally, you want to have a quality internet speed where you have good connectivity. I know certain areas still struggle with bandwidth and broadband. So we are working with many of those communities to increase access and to make sure that they have the quality internet that they need in order to have these consults. But we tell people if you don't have great internet in your home, you can go to a public space if you're connecting and presenting back from your own devices and not at one of our presenting sites. Maybe put on some headsets and make sure that you're in a quiet space. Now, peripherals are one of those things that you use depending on what type of clinic you're in and what type of consults you'll have. When you go to some of these clinics and locations, and I'll show you some of those equipment and peripherals in just a moment, you may have some additional scopes that will be leveraged, such as a stethoscope, an otoscope, a derm scope, where they're able to look at areas of concern. We sometimes have teledentistry, so you'll have some dental scopes, even colposcopes and fundoscopes, and many ultrasounds. So again, that going back to the whole, there's not a one size fits all. Every telemedicine clinic is unique. There are often wearables, like we mentioned earlier, for remote patient monitoring. You could have some smartwatches, you could have some EKG monitors, you could have some blood pressure cups, some spirometers. Really just determines what you're looking at and what your provider really needs to see. And those include some of those remote patient monitoring devices. This just gives you a snapshot of the various telehealth equipment options. As I mentioned, how they all look different. You can have anything from a backpack to a wearable device to an RPM kit that is shipped to your home, to a stethoscope, a Bluetooth stethoscope, a hardwire stethoscope, a telemedicine backpack that has all the equipment bundled in one small solution, a miniature rolling cart that might be at your bedside in an emergency room, or a full-on, like we like to say, Mac Daddy Big Works telemedicine cart with dual monitors, where your provider might have two different monitors, one uploading their information into your electronic health record and another with you on that big screen. And then the peripherals vary, again, based on the type of clinic. So Again, there isn't this whole, it must be this, it must cost me 3,000, it must cost me $30,000. Really just determines and depends on what you need and what your practice needs or your healthcare organization or what you need individually to be able to connect back to that provider. I also think it's really important, while we know there are various platforms such as Zoom and Doxy and Teladoc and Amwell and Pathways and so many other web-based telemedicine models and platforms that we know, I think it's really important to know that no matter what platform or choice you use, the most important is the image and the quality of the consultation. It is true that telehealth must be equal then or better than an in-person visit. And I know that's the success that we have of our telemedicine program through the Global Partnership for Telehealth, is that many of our providers tell us that the quality of the images that they see sometimes through our telehealth platforms and tools are sometimes even better than those that they have in person when they're seeing their patients, specifically inside the ear and down the throat. Those quality images, as you can see here on the screen, I hope none of you are in the middle of lunch when you're reading this or seeing this, but you realize that quality does matter. And that goes back to the whole internet quality and broadband, that you really want to make sure that if you're looking at something and a provider is diagnosing something, that they have the best images available. Again, these are still shots, but these happen to be real-time scenarios where we are taking screenshots during a live encounter and sharing it with the provider. So I know this slide might be a little small and kind of busy to read, but we'll talk through some of these scenarios one-on-one in just a moment. But I wanted you to see that there are various types of telehealth applications that you can leverage, from behavioral and mental health to home health services to hospital inpatient and outpatient settings, emergency services, and even school health settings. For telemental health services, we really like to look at that remote therapy sessions where we know individuals engage in those one-on-one group therapy sessions with mental health professionals, and they leverage video conferencing tools or even phone calls. But most of the time for telehealth, it is a video conferencing platform where they're able to have those sessions. We know that online therapy as telemental health is a truly growing field, and these therapists and counselors provide that psychological counseling and support over the internet, which helps so many individuals who may not be able to leave their work, their home. They work unconventional hours, as well as those maybe overseas or those who live in rural and remote areas that don't have as many providers close to them. So we leverage telehealth. Same thing for medication management, maybe some crisis intervention and suicide prevention. We have tons of virtual support groups that we've heard of where individuals participate in these online support groups for various mental health conditions. And it really helps them foster this sense of community and connection where they're able to connect with people virtually from the comforts of their home or, like I mentioned, in those unconventional hours. EMS is a new kind of innovative tool, and we know many of our partners in Georgia are leveraging tele-EMS and leveraging those video conferencing and telehealth solutions for real-time consultations between EMS personnel and those remote healthcare providers, whether it's using mobile apps for securing their data sharing and image transmission, and even utilizing those remote monitoring devices to transmit the patient data. So just think a community paramedicine model, or another example is like this ER TEMS team, this network that Emory has established, where their rural health network has this really cool pre-hospital and ambulatory virtual emergency services program where they provide telemedicine services to ambulance crews across rural Georgia and connect them back with Emory emergency physicians for virtual consultations, really enhancing that access to that specialized care that they might not have in some of their rural hospitals or have on demand. We really know that for us, the ultimate goal is really to help address those disparities in medical care and supporting EMS and enhancing access to that quick, timely healthcare. So just imagine getting onto the ambulance and having a tablet on the back of the ambulance propped up so the patient can be seen by a physician. The camera might be on the roof of the ambulance, which is what the doctor's using to really view that patient. It has this really cool noise canceling feature, and then all the equipment necessary on there for that paramedic to connect, whether it be a defibrillator or anything, so that when the physician calls, they can actually see those vital signs in real time. So really looking at that specialty care for patients that might have this long transport time to the closest hospital and really taking care of them in real time and just in time and having all the tools that they need essentially. Another innovative model that we're seeing a lot more of is these telehome health services, also known as telehealth and home health care, where they leverage technology to deliver that healthcare remotely, offering those benefits like continuous patient monitoring, real-time consultations, improved access to care, especially for those chronic health conditions. As you can see in that image, it's also really interesting to be able to leverage telehealth so that your patients are connected back to their families. So how wonderful is it that you go to visit, a loved one, but you sometimes can't get there because of the schedule or the time or the distance? Knowing that they have an option to have a telehealth consult and bring you into that consultation, their bedside, and feel like you're a part of that conversation, and hearing the follow-up, hearing the nurse's orders, hearing from the physician all in real time, is very unique and a really innovative way to leverage telehealth. As you can see on the same patient, the example across the top of maybe that remote patient monitoring where flags of blood pressure concerns might rise. And that virtual nurse could come in and work with the on-site nurse to just identify any medication conflicts or any issues, and rescheduling them and stabilizing that patient's condition without having to transport them to the emergency room, is key and crucial and an amazing way to leverage telehealth technology. We also love our school telehealth service programs where we know that services offered can include anything from primary care, those annual checkups, screenings, behavioral health consultations, chronic disease management, and specialty service appointments. We know that many of our school-based health centers leverage telemedicine for those specialty care appointments for things such as endocrinology, pulmonology, and so much more. Really, our school nurses tell us that leveraging telehealth, we know the obvious is increased access for those with limited transportation, helping patients and students avoid those long wait times, addressing any provider shortages, but also the convenience in reducing absenteeism. By the time a kid goes into that school nurse's office, is seen, the nurse calls the parent, has to pick them up from school. The parent then in turn needs to make a doctor's appointment. That may happen the same day, it may happen the next day. The kid misses out on school. The whole circle that you guys can all imagine. Having a school-based health model and a telemedicine provider, they're connected, allows those school nurses to present those patients at any point in time when they come in for the day, have everything taken care of, the patient connected, the parent connected, whether they come in person or connect virtually, having any referrals or any medication made, sent to the local pharmacy, parent picks up the prescription, kid goes home. Again, reducing that absenteeism and really making sure that those students are set up and successful. We could have an entire conversation just around our school-based telehealth service models, but I really just wanted to give you a snapshot of some of the different modalities and opportunities that telehealth and telemedicine are offered, and how we're leveraging these technology tools. But as you know, I've given you all these great success and examples of how telehealth can be used, but it's really important to know that with anything, there are challenges, and we know that. We are not oblivious to it. One of the biggest challenges is just overall acceptance and buy-in. As we're working on leveraging telehealth, many people are just like, I don't want another thing to do. I don't want to deal with the technology. Sometimes it freezes, or we're only as good as our internet, and I don't have good internet here, so I'm not interested. Getting that initial buy-in and finding those champions within your community is really where most of the work happens. It's probably the longest process for us is really just getting that support and that understanding and that buy-in and doing some demonstrations and showing success stories and best practices. Once we're there, we quickly in turn look back at your connectivity and your broadband and determine if your clinical site has the tools necessary and the right broadband access to connect you. And then working through credentialing and licensing, which we know is different in every state. Fortunately, in Georgia, we have a really good credentialing program. We have a good licensing program. So telehealth licensing is pretty straightforward and seamless. But we know that other states face various challenges with credentialing. We also know the process is not always as quick as we'd like, but we do know that it is a barrier in many other places. I would say reimbursement was the biggest challenge for so long, but I think the COVID pandemic has really allowed so much to grow and so many things to change. And I think it's really important to see that. And we'll talk a little bit more about that in just the next couple slides as I give you some really cool telepolicy updates around reimbursement. Again, I just want to take a couple moments. I don't want this to be overwhelming. I don't want this to be too boring. I don't want to put you to sleep, but I do want to take a moment to share with you some of the updates that I know are probably top of mind around telehealth for those of you that have been following it closely. Again, I'll be specifically talking to you about Medicare as these are federal across the nation. Just as a reminder, I don't really touch on a lot of Medicaid telehealth reimbursement because we know that is largely determined by the individual states. And it offers a lot of flexibility in coverage and payment. So Medicaid is pretty straightforward and pretty easy, I'd like to say, with a lot of reimbursement for telehealth. It's the Medicare that's constantly changing. I know personally our office is in Georgia and I live here in Georgia. Medicaid covers telehealth services, including mental and physical physical health at the same rate and the same way as an in-person visit. You just have a couple modifiers you sometimes have to use. So we are very blessed here that telehealth is supported by our Medicaid office, and many of our CMOs truly leverage telehealth for their Medicaid population. This slide's pretty heavy and pretty loaded, but I want to start off with a disclaimer that's saying recent legislation, we're super excited to know that they authorize an extension of many of the Medicaid telehealth flexibilities that were in place by the COVID-19 pandemic. Everyone kept saying December 31st, it was over and everything was going to go back to how it used to be, where nothing is reimbursed and you have to go in person. But as of right now, everything has been extended through September 30th, 2025. We keep building the cases, we keep showing the case studies, we keep showing the success, and we hope that this will become a new standard. So I think that's really important. When looking at these slides, again, it's kind of heavy, but I really want you to know the biggest takeaway is that individuals mostly impacted by the telehealth waivers are really going to be all those Medicare patients in rural areas, specifically those receiving those like non-mental health services. Any of those patients who rely on out-of-state providers, maybe those with limited mobility, is they're not likely going to be required. They're going to likely be required to travel further for some of those in-person visits if telehealth extensions do not stay. So again, really kind of defeats the purpose of telehealth, where we're focusing on the elderly, those chronically ill, those disabled patients, those that don't have true access in their local communities, those who are currently receiving their services virtually. If this does not get extended after September 30th, we'll have to go back to traveling probably a little bit further to get to those providers, which we know then the providers in turn will have to shift back to providing those services to patient in person and completely drop that telehealth appointments. So again, when you're looking at geographical and originating sites, as of right now, patients can be in any geographic area in any setting. So patients can participate from their home, which has been a huge success, where you're able to connect virtually using your iPad or your smartphone or your Android device back to your providers who offer it. If this policy does not get extended, many of those patients will have to revert back to CMS listed eligible sites. So there is a list of eligible sites such as local community health centers, FQHCs, local health departments, where a patient would have to drive to and then be connected via telehealth, and eliminating that easy access consultation of virtual. As of right now, audio is allowed, so audio only. Let's say, for example, you want a teleconsult, but you don't have a video camera or you don't have access to one. You can talk to your doctor over the phone for a teleconsult, and that is accepted at the moment. However, once this extension, if it does not get renewed after September 30th, audio will not be accepted as a modality for telehealth. So again, a couple of those, that same as the distant site, you'll have to really look at what is considered a distant site, where can you go to be presented, and or what providers are going to be allowed to bill for those visits. So again, as of right now, the goal is continue to do telehealth and telemedicine as you see fit, exactly how you're leveraging it, keep building the case, show the return on investment, and we hope that we will continue to push this extension and make telehealth a standard model of care moving forward, with all reimbursements and not taking away and limiting the services. I think it's really important for you guys to track these and just be aware of them. I know many people are like, well, how do we find these updates? There's so many updates, they're coming a million directions. I think it's really important to share with you some of these resources, and these slides should be made available to you, where you can click on some of these hyperlinks. But there are tools and resources available to you, such as the National Consortium of Telehealth Resource Centers, where you can get weekly updates on telehealth notes, where we are with telehealth. The Center for Connected Health Policy really does a great job. They have an annual newsletter, but their website has it broken down by state and allows you to see what your state health policies are around telehealth and telemedicine. Our HHS partners are doing a great job at continuously updating us with telehealth updates. The American Hospital Association is always sharing fact sheets with their telehealth waivers. And I also listed the Medicare physician fee schedule, which allows you to see those reimbursements, what's coded, what's allowed, and what's not allowed. So I hope some of these tools will help you as you're thinking through telehealth and telemedicine. But the way I like to see it is, well, you've given me a lot of information. You've shared with me a couple ways that it's leveraged. I've got some ideas on how I want to leverage telemedicine, or maybe even considerations. What do I do? And I like to say, have your plan. I love that you have a plan. I love that you're thinking about it. I love that even if you weren't thinking about it, maybe I've convinced you just a little bit to think about it. So then what? Now I think it's important for you to do a little bit of research. Learn your state rules, learn your state regulations, see what's available to you, see if the service you want to offer is reimbursed and is reimbursable, and at what rate. Then let's look at what services are covered. Like I mentioned, what do you want to do? What's the reimbursement? How can I do this? Then you come to us and say, okay, I think I'm ready. I need to help. I need help choosing a platform. I need a vendor. I need some equipment. How can you help me? What are your recommendations? And that is something that we do through our Southeastern Telehealth Resource Center. We provide this free consultative service to you. We are one of 14 telehealth resource centers. There are 12 regionally and 2 nationally that are funded by the Federal Office of Advancement for Telehealth through a grant program to provide just that support, technical assistance, guidance to anyone looking to implement telehealth programs. Our mission is to serve as that focal point to help you advance the telehealth usage and support access to telehealth services in your rural and limited access communities within our region. I personally serve within the Southeastern Telehealth Resource Center region, which is the bottom right region. We have an extensive telehealth experience, provide you with any of the tools, any technical assistance, questions. I'll share you a little bit more of kind of different things we can offer, but we cover currently the states of Alabama, Florida, Georgia, South Carolina, and the US territories of Puerto Rico and the US Virgin Islands. As you can see, we have tons of friends across this nation who also service various areas, and we are all one close little family, I will tell you, and we all work together very well. So even if you don't know who the contacts are and you don't go to this website, you can always shoot me an email and I will connect you to anyone within your region. Or if you do business in other regions and you have some questions, we are always happy to help you and serve you and help you kind of get your programs off and running. We provide any technical assistance you need, but we really focus, again, really important, at no cost. We can help you with reimbursement guidelines, helping you build needs assessments. We can share templates with you of staff roles and job descriptions. We have tons of consent forms we can send your way. We can help you with clinical and operational workflows, telehealth trainings. We have a lot of web-based telehealth trainings that are already established through our learning management systems that we can share with you. They can be introductory to telehealth. They can be presenter training. If you're a provider, what do you need to look out for? How can you present a patient? We have sample marketing plans that many of our districts and regions have done. We also can provide suggestions on platforms, equipments, connect you with multiple vendors to give you options and really let you guys pick what you think works best for your organizations and know that you have a trusted source who really doesn't have any stake in the game per se in that capacity and influence in your decisions. So we are here for you. We really want to help you leverage telehealth and telemedicine. We want you to take back telehealth and telemedicine as a concept maybe for your organizations. And if there's anything we can do to help, we're just a phone call or email away. So I hope this was beneficial. I know I rushed through a couple things, but I really wanted you guys to just be aware of telehealth, put it front and center if it wasn't top of mind. Consider telehealth within your own practice. Maybe ask your provider if you're not working in a hospital system if telehealth is available to you. And if not, put them in contact with us and let's see if we can help them build telemedicine programs. So with that, I thank you for your time. I hope you found this of value and we look forward to talking to you soon. Thank you so much.